Our breaking news this hour, President Cyril Ramaphosa is due to address the nation on the country's next move with regard to COVID-19. This follows a special sitting of cabinet. Now, for what we can possibly expect and where we are as a country, I'm joined in the studio by our senior politics reporter, Ziyanda Ngcobo. Good to have you with us once again, Ziyanda. Another family meeting tonight. What ought to be expected? We do know countries, hotspot provinces like the Eastern Cape, the Western Cape, even KwaZulu-Natal, those three have been flagged.
Certainly. So, I mean, a lot of what we're expecting is already out in the public domain. The fact that the curfew is likely to be extended and to start at 10 p.m. in the evening and still end at 4 a.m. Seemingly that has been one of the measures that still, despite, alcohol previously now being extended to being sold over the weekends, the curfew has been able to assist then with managing the numbers. But the issue of a second wave of COVID-19 is something that government has been speaking about for quite some time now. And yesterday, if you look at the daily infection rate, we had over 4,000 new infections in a day, and that's the largest number of infections we've had since around August. So the threat and the reality of a second wave of COVID-19 is actually here. We've heard from the various premiers. Gauteng Premier David Makhura, during his announcement of a new health MEC, was touching on exactly that. And of course, we know the coronavirus moves according to the movement of people. That's how it predominantly moves. As we edge closer to the festive season, many planning to go to their respective home provinces, that could Eastern Cape or Western Cape, there's a real threat that wherever people are going, they could take the virus there or even return then to their provinces with the coronavirus. So really managing the movement of people is also going to be very critical to what the president announces this evening, but also the sale of alcohol. KwaZulu-Natal today announcing that big major events will be cancelled during this festive season, but we know there's going to be quite a pushback from that. We know, for an example, that artists had already taken to the streets. They would have wanted to use this festive period to try and recover from the money that was lost that they could have made during the hard lockdown. So it's been a tightrope then that the National Coronavirus Command Council had to manage. But I think the main issue that they're trying to, really maintain and contain, rather, I should say, is the issue of January. What will our January look like after the festive season?
And you'd have heard as well, Premier of Gauteng, David Makhura, making note of that as well, saying we do not want our January to be like June as far as the numbers are concerned. But do you see a potential, I guess, a curtailing of interprovincial travel at this time? I mean, you mentioned the fact that abantu bayahamba baye emakhaya, so there's going to be a lot of cross-border traveling between the various provinces. Do you think that we might see that once again being reinstated, or would that be a bit too much for now?
Well, it's not impossible. One of the factors that the National Coronavirus Command Council they look at the impact on the economy. They look at whether or not the healthcare system is able to carry the number of infections. And then, of course, they look at the daily infection rate, which we know has increased quite sharply over the last couple of days, especially yesterday. So interprovincial travel and the restrictions thereof is not something that I would shrug off immediately, especially now that we're going into the festive season. I think the main thing that is usually looked at is the economic impact and how to actually balance the two, lives versus livelihoods. And we've heard government saying that it's not either or. I think one of the issues then that the president will hopefully also address is the article that came out in News 24 to say that South Africa has actually not made a payment of 500 million rand to actually secure our ability to get access to the coronavirus vaccine. We know that the UK has made significant strides when it comes to this vaccine. I think the amounts that they're getting will be able to provide for 20 million citizens. So there's the issue of, it being in everyone's everyone's hands, as the president has previously said, but also we need to get an idea, in a sense, what the South African government is doing at the moment to get just and equitable access to a possible vaccine to COVID-19, given our current economic situation. We did not start off the year. We were in a technical recession, to be quite frank, and there are many measures. We know the Restaurants Association just yesterday was already complaining about them seemingly being targeted for these restrictions. In the meantime, they actually have lost out. Some restaurants have closed down permanently. And so whatever restrictions are going to be announced, such as the curfew, such as the hotspots, what then defines a hotspot yet again, because that we know this definition has sort of been moving and changing depending on the context. And so it seems as though each province then is going to be left to manage, the handling of the virus on the basis of where the hotspots are and the events that would take place there, and what exactly is driving then the increase of infections in those particular regions.
You mentioned the Restaurant Association and their discontent with many restaurants having closed, and it's the same sentiment that accommodation and hotels are experiencing now, with some of the accommodation on the garden route actually already closed and not being allowed to operate during the festive season. What do you think we're likely to see regarding tourism and hotels and accommodation, and which accommodation will be given permission to operate and which will not, and how are South Africans really going to know what is available for them and when?
Look, the tourism industry is one of the hardest hit industries since the arrival of the COVID-19 pandemic. Not to say that other industries haven't been affected or impacted upon, but the tourism industry significantly so. Even the hotels and accommodations that are still open, they're operating at a minimal level, and they've had to change their pricing models, etc. We know then that Health Minister Dr. Zweli Mkhize is actually in the Western Cape today, visiting that garden room. He's also in Knysna to assess the situation there. He was also in the Eastern Cape. He spent a couple of days there a week or so ago as well, to assess the current situation in the Nelson Mandela Bay because of the spike in the numbers there. Now, when you look at the impact on the tourism industry, I believe that they're probably going to push back the most, as well as the liquor industry.
And entertainment industry, events and entertainment. That's going to be a huge one as well. Ziyanda, thank you very much for that. I guess we'll wait for 8 p.m. tonight to find out, which of these areas the president will indeed be touching on. Thank you so much. That's our senior politics reporter there, Ziyanda Ngcobo. And also, perhaps, we know that New Year's Eve is very big in South Africa, the crossover and how that happens. Will that actually be discussed by the president? Are there going to be regulations as to how you can celebrate your crossing over from 2020 to 2021 as far as the events are concerned?